Good morning, Gabriel.
Good morning, Margaret.
How are you?
Good, thanks.
Good. Now, we have a few quick-fire questions, I suppose, to go through. But also this morning we're going to be concentrating on helping maybe prevent colds and flus or for the winter.
Definitely have your pen and paper ready. And
have the pen and paper ready, exactly.
Some recommendations.
Now, we'll just go through firstly some of the questions that we had left over from last week. This listener has a lot of pain in their joints, especially in cold weather. Could they have a form of arthritis?
Probably, yeah.
Maybe if you don't mind pulling that mic around, Gabriel, towards you just a wee bit more. That's lovely. Yep. We're all organised now.
Yeah, possibly they could have a form of arthritis. A type of treatment I might use for that is herb devil's claw or hops. Also check vitamin D levels, good quality cod liver oil or fish oil. All of them great for arthritis. So
those, just based that's all you have to take? And I suppose, do you have to watch your diet? And
Definitely. This is a kind of a quick fire round, but if we were kind of going to draw it out, there's lots of things you could do in diet and so on. Depending on what form of arthritis. Is it rheumatoid, which is an autoimmune condition, or is it osteoarthritis, which is completely different, but it's a disease of the joints as well. So treatment protocols are a little bit different for either. But diet very important. So that was just a quick sum up of some herbs and stuff that I do. Yeah.
Okay, this lady says that her eyes are often bloodshot. What could cause this?
I don't know really. It depends how you'd go about addressing that. Is what could be causing it. So is it a trauma? I had a friend once did a bungee jump, and after that they blew some blood vessels in their eyes and bloodshot eyes for weeks after. But it's likely this woman has it long term. So long as there's not something in there, a foreign body, dust, something like that, it could be due to eye strain or fatigue. Is she overusing her eyes, studying, computer all the time, TV? And there's a little technique called palming that's very good for that, just to relax the eyes, where you block the eyes with the palms of your hands and put them in complete darkness and relax them for 5-10 minutes, and do that a few times a day. That's just good for people studying and who are busy on the computer and so on. Chemical exposure and smoke could also cause it, but possibly if it's a long-term chronic thing, it's probably due to inflammation or some sort of itis. So anything in medicine with itis at the end of it is an inflammatory condition, and there can be quite a lot of them relating to the eye, which is iritis, uveitis, conjunctivitis, scleritis, and there's a couple of autoimmune conditions, Sjogren's syndrome and chronic dry eye. So to do with an autoimmune condition, the caller should really give me a ring. It's quite a complex thing, but it's generally to treat inflammation. And also if there's an infection there's certain herbs and washes you can use, or if is she constantly itching it, and why why is it itchy. So a couple of simple things: a marigold tea, so tea made from marigold flowers, let it cool and use that as a wash is great too, as a disinfectant or for the itch or any kind of irritation. Or if there's something getting in there like dust and stuff, like a simple saline wash, salt water solution, just to wash out her eyes regularly with that could help.
Okay, this caller gets a lot of mouth ulcers and bleeding gums. What could you take to prevent this?
Well, the mouth ulcers, if they're the canker sores in the inner lip, it could be due to food allergies or sensitivity to something she's eaten. Maybe probably the top three culprits there are wheat, citrus foods or chocolate. So it's important to kind of identify what might be causing it and what kind of allergen may be causing it. I definitely eliminate sugar if I had a lot of mouth ulcers, and bleeding gums, probably gingivitis, which is just kind of an inflammation or kind of a low level of chronic infection of the gums, causes them to be red and weaken and to bleed, either on eating or brushing. And things that can be good there is herbal mouthwash of I make it with a tincture of myrrh, salvia and golden seal, and so they're antibacterial, antimicrobial, mucous membrane tonics, and if she swishes with that a couple of times a day, it can largely help.
Okay. Thinning hair, any supplement to take?
Well, what you need to do here is work out why it's thinning, and sometimes it's $1 million question, this one, but if there's many reasons it could be. One is it could be a nutritional reason, a lack of certain minerals or trace elements. Remembering the hair, I forget the number now, but it grows meters a day if you add up all the tiny little bits, we'd say. But here, the constituents of hair is protein. If you're deficient in protein, the body may prioritise your proteins to go to the organs or whatever, and the hair won't be high on its priority. So that's one thing. Make sure you're eating good quality proteins. Now, a kind of a cohort I see this in is vegans or vegetarians who aren't really following or diets quite well, or they're lacking in good quality proteins, and it's very important that they get good quality proteins. I check thyroid function. It's also a reason for hair falling, mainly in women, but it can be men too. If it's underactive, one of the effects of that is that your hair will thin. But a general hormonal imbalance can affect thyroid function too, so that's something needs to be looked into. Again, it's down to working out what's causing it. If there was something she could take, ginkgo biloba, it's a herb. It's shown to increase circulation to the head. Now, so it's a herb generally can be used for concentration, cognitive function, and so on, memory enhancement. And how that works is, at a basic level, it increases the circulation of blood flow to the brain, and it's shown it can be helpful in people with hair loss, where if you have blood going there, it's going to nourish the area and the follicle cells and so on. So it's something they can try. One of the ginsengs, Korean ginseng or Panax ginseng, it's shown in clinical trials to promote hair growth in animals. It's a tonic for the hormones as well, so maybe that's how that works. And then one, I suppose, closer to home, be nettles.
Right.
And
nettles.
Yeah, just your common nettles, and they're great to strengthen weak tissue, and it's probably behind its traditional use as a hair rinse to strengthen weak or falling hair. But nettles are abundant in minerals and trace elements. And possibly how they work is repleting these minerals and trace elements needed for proper or robust hair growth. But traditionally, they were picked and thrown into stews or so on.
Nettle tea, don't you get nettle tea?
Yeah.
Yeah.
And you can give it a go, and it's quite nice too, actually. But so a simple answer, I suppose, is why is it thinning, and then address accordingly.
Okay. Now, this listener has lots of white spots on their fingernails, so what could cause this?
All right. Well, we can tell a lot of what goes on in the body by the fingernails.
Really?
Yeah. Well, if your fingernails are like poor and
brittle
fraying all the time, and so on, that gives an insight into the nutritional status of the body. And white specks, I'm assuming the caller has them a long time, and it's not due to a kind of a hitting it with a hammer or so. If you bang your nails, you get a white speck. But apart from that, if you have them ongoing on all nails, just these white marks that are there and grow out and then new ones form, I definitely look into the metabolism and utilization of calcium. But what you really need to do here is look at vitamin D status as well. So without proper levels of vitamin D, you will not absorb and utilize calcium properly, and that goes for anyone with bone disease as well. So vitamin D, very important here. Good quality calcium in the diet, possibly zinc too. So they're the three main ones. As a recommendation, I'd use unrefined sea salt in my food. So table salt is a poor product, and it should be avoided, in my opinion. But unrefined sea salt shouldn't. It's something that everyone needs certain levels of salt, but unrefined sea salt has 82 minerals and trace elements, and they're all there in small amounts, but they're there in a kind of a synergistic way. We've evolved with salt in our diet, and we definitely need it. A lot of the salt you get in processed foods and that you add table salt has these minerals taken out, and it's bleached white and add anti-caking agents so it'll spread nicely and evenly and so on. But just an unrefined sea salt is quite beneficial for and it'll cover a lot of bases of any kind of minerals and trace elements.
Okay. This caller has a stomach ulcer. They watch what they eat, but is there anything herbal they could take to help?
Yeah, I'd love to know what they're eating, even though I know they watch what they eat. I get a lot of people.
Wouldn't an ulcer be irritated by what you eat?
Definitely, yeah.
Yeah.
So, a lot of people say to me, I have a great diet, so what would it be? But I'd love to know what they're...
But is there things like fruit, certain fruits that could irritate it, like oranges or something like that?
Yeah, citrus fruit, because they're acidic, has been shown to irritate ulcers. It's a bigger picture, though. Is the person taking aspirin? The reason I ask that now is a lot of people take it over a certain age. If they're prescribed it by their doctor, then they should tell their doctor they have ulcers, and there should be a good reason why they're taking it. If they have had a cardiovascular event in the past, then maybe they should stay on it. But if they're taking it because their friends are taking it, or just as a preventative, they should really stop if they have ulcers, because it could be the main cause. Diet is definitely a factor.
Maybe there's someone that you need to actually sit down with and see what they are eating, and maybe try and identify or something.
You always need to work out what's causing it. So, like a stomach ulcer, I watch my diet. What can I take? It's not adequate information, but you need to kind of work out what's causing the ulcers. Foods, definitely fatty foods, chocolate, caffeinated or carbonated beverages, alcohol, smoking, certain drugs. All these can cause ulcers, and for many years it was never seen as an infectious component. But just recently, with the discovery of Helicobacter pylori, there is an infectious component. So it's a bit more complex. If we were to pull maybe 10 people off the street, I think 7 of them may have Helicobacter pylori in their stomach or their digestive tract, but not all 7 would have ulcers. So it's related to it, but it's not the whole picture.
It's not the big picture.
All these things need to be looked at, but the likes of antacids and stuff like that are only a patch. So if they're taking a lot of these antacids and they reduce the symptoms and the pain, fine, but it's not going to get at the underlying cause. Regards herbs, meadowsweet would be the kingpin here that I personally use anyway. On people, it has traditional use of gastrointestinal conditions associated with hyperacidity. So if they're producing too much acid and so on, and that's the cause of the ulcer, then meadowsweet is great here. It's high in tannins, has a protective effect on the esophagus lining and the stomach, and it has high salicylate content, which is anti-inflammatory and kind of has a pain-killing effect. So best used in a tincture or a tea form. Also licorice or Glycyrrhiza glabra, it's the root of a licorice, and it has mucoprotective actions, and there's some good scientific research to show that it is quite a beneficial effect on ulcers if you use a certain extract of it. There's some diet and lifestyle recommendations worth noting. Water intake, I'd ensure you have adequate water intake, because inadequate water intake has been linked to things like gastroesophageal reflux disorder and ulcers. Give yourself time to eat. Don't rush through meals, or rush a quick sandwich at your desk or whatever. And if you're overweight, make an assertive effort to lose weight. So people with ulcers, there's a high incidence of them that are overweight, and if they lose weight, it has a beneficial effect. A couple of simple things, I suppose. If it irritates you at night when you lie down, then you can maybe raise the head of the bed by 6 inches, and that could that alone could have a very beneficial effect if it's affecting sleep and so on. So it's just a functional fix, I guess, but
it could help. Okay, we have a quick break to take now. If you're someone who suffers from colds and flus, Gabriel will have some things that you can take to help you out.
Our housing estate Ballylint was 30 years built this year, so we decided to raise money for a bench in memory of all the people who passed away in the area and a booklet with stories from the local people.
Youth groups all around Ireland are carrying out projects to enhance their communities in all sorts of ways.
We brought books out from the library and brought them out to people who couldn't get the books themselves. We mothers with young children who couldn't get out, or the elderly. Or I brought them to my uncle and another woman who lived on the road to me. She really enjoyed when I came out to her just to chat for maybe half an hour, an hour.
Permanent TSB, supporting Feroga youth projects across Ireland.
The Face of Ireland competition presents A Night with the Stars of Country Music in the Abbey Hotel, Donegal Town on Wednesday the 18th of November, including Declan Nerney and his band, Louise Morrissey, Trudy Lawler, Hugo Duncan, Ray Lynham, Philomena Begley, Kathy Durkin, John Farry and special guests. Doors open at 7:30pm, show starts 8pm. For tickets and information, phone the Abbey Hotel, Donegal Town on 074 972 1014.
Geraldine Oaks Boutique Ballyshannon. For the best dressed mother of the bride or groom, come to Geraldine Oaks and get the wow factor. We offer first class personalised service to help you choose that special outfit. Geraldine Oaks Boutique Ballyshannon.
This Halloween, give your savings a real treat by moving them to EBS, because our 15-month fixed savings account has a rate so good, it's spooky. An impressive gross return of 4.3% for balances of €3,000 upwards. So switch your savings today. Drop into your local EBS or call 1850 20 36 36. AER 3.43%. Interest subject to DIRT. Maximum balance €500,000. No additional lodgements. Terms and conditions apply. EBS Building Society is regulated by the Financial Regulator.
Tasty treats for your little ghoul or goblin this Halloween from O'Hare's coffee shops. Gingerbread bats and pumpkins, sticky fudge cake, scary chocolate cake, Halloween tea brack, and Halloween barn brack. Toffee fudge cakes, bringing your little monsters for a free in-store treat. O'Hare's Bakery, a tradition of excellence.
Specsavers are pleased to announce their latest offer.
Harrison, are we in?
Yes, sir. We've hacked the signal.
Excellent. Now nobody will hear the new Specsavers offer.
What offer?
The one we're trying to cover up.
Oh, yes, free varifocal lenses.
Don't even say it!
What, free varifocal lenses? But that's really good, isn't it?
That's precisely the reason we don't want people to hear it. It's a good job you didn't leave that microphone on. Harrison!
Applies to standard varifocal lenses with glasses from €99. See in store for details.
To have your say, call the Northwest Today comment line on 0818 365 500. Text your comment to 083 3500 530.
And you're very welcome back to the programme. We are in the company of Gabriel McSharry, who's a medical herbalist and nutritionist. Now, Gabriel, someone texted in there, they have given up smoking about 2 weeks ago, and they have a cough and they just wonder, is there anything that they could take?
Right. Well, you're gonna have a cough for probably a while if you give up smoking and you've been smoking for years, and really the body and the lungs are just going to clear out a lot of stuff that's in there. So may get worse before it gets better. There's some respiratory tonics that we can use that enables the body to easily break up the mucus in the lungs and clear it out a lot faster and easier. So something like that it would improve. There's a herb actually called Lobelia inflata, and it has an alkaloid in it, lobeline, which is very similar to nicotine. Mm-hmm. And it binds to the same receptors in the body. So it's something that has been used to, just as an aid, if someone's given up smoking, just to kind of take away maybe the cravings, the nicotine side of it. That generally lasts, I think it's 6 weeks maybe, the nicotine craving and so on. After that, it's all in the head, so really the body's going to take about 6 weeks to get rid of the physical addiction to nicotine. There's other chemicals in cigarettes, there's 40 maybe that are addictive, and so it's not just nicotine. So your body has to kind of lose its addiction to these. And I think it takes about 6 weeks or so.
Okay.
Then after that, it's down to
willpower. So
definitely, and some people associate cigarettes with a coffee or a drink, and they just need to change their habits and.
Try really hard.
Yeah.
Try hard, okay. Now, something that I would suffer from myself, which is a lot of colds, and a lot of people out there are the same. So we're going to talk a little bit about how to maybe...
Yeah, well, we're coming into the cold and flu season, so... there's prevention and treatment, and prevention is key a lot of the time. But the key here is to keep your immune system robust and working in optimum working order. So if you have a robust immune system, you won't get colds and flus in general. It's why if there was a room full of 10 people and there was a flu going around, some wouldn't get it. Some would get it, have mild symptoms, and some would be nearly dead on the floor, So it's to do with immune function. So diet is key here. Sugar, eliminate it.
Really?
Not cut down, eliminate sugar. You get table sugar out of your diet. It's a useless product. It's no good for the body. It cuts your immune system in half.
So are we talking here as well, like cakes, chocolate?
Yeah, yes.
Thanks, Gabriel.
I thought you were going to say, are we talking fruit juice and that? And I am as well, to a certain extent. Now,
unless you make your own at home with your squeeze or oranges or...
make vegetable juices at home, but not fruit juices. If you're going to have fruit, which I recommend, eat the fruit. But if you were going to squeeze, like, say, 7 oranges, you're taking the sugar component out of 7 oranges, and you're taking that, and it's too much sugar in my opinion. But you wouldn't sit down and eat 7 oranges, So there's proteins and fibres there that you're having as well, and they kind of stabilise blood glucose levels and stuff. So definitely table sugar, right? So that's adding sugar to your tea, but then cakes and chocolate and so on, like you said as well. I eliminate that. Natural sugars that you get in fruits and vegetables, you'll be fine. Use a little bit of honey to sweeten, or an 80% cocoa dark chocolate for replacement as chocolate. But as I say, sugar cuts the immune system in half. So you're running on half cylinders when you're eating a high sugar diet. So that's key here to keep your immune system in good shape. And actually there was a great documentary on Dispatches the other night. I don't know, it was the last 2 nights, on breakfast cereal, laden with sugar, really denatured flakes and highly processed breakfast cereal. A lot of sugar added, but they all kind of break down to sugar anyway. And
then people are inclined to reach for the sugar bowl to put it on the cereal, like if they're eating that.
Yeah, definitely. So you've got to eliminate sugar, but it doesn't mean just the sugar you're adding to tea or something. It's all products that contain sugar. Get rid of them. They're no good for your immune system. It's addictive. It's going to take time. You might get some sort of withdrawals, headaches, and feel terrible for a while. Get through it, and you'll be better on the other side of it. Also, trans fatty acids. They promote inflammation in the body and distort the immune function. So there are things that are in margarines and heated oils. So potatoes and chips. Anywhere where the oil is heated, olive oil is brilliant for the immune system, but you just keep it cold and pour it on salads and so on. Don't fry with it. Regular exercise, really important. So beneficial to the immune system. A 30 or 60 minute walk daily. It increases the circulation, which facilitates healthy immunity. Try and get out in the fresh air and sunshine, that'll make it a lot better. Get adequate sleep and rest. Really important. The body repairs itself during sleep, and if you get good repair phase, then during the day you'll be in optimal shape. Keep stress to a minimum, so don't overexert yourself physically or mentally. So we all need to work on that one. Maintain personal hygiene, wash hands and so on. I take a good quality cod liver oil, so one that's high in vitamin D. I take a vitamin D supplement. If you're getting a lot of colds and flus, I'd get your vitamin D checked. what level you're at, and like get yourself up to the high normal. So if normal is between 70 and 200, you want to be up near the 200. It's very, very important. So that's a few general things for prevention. Treatment. So if you do contract a cold or flu, what can you do? And herbs work really great here. So a few ones, I mean, there's loads you can go through, but I'll pick a few that is good scientific research. Echinacea, probably the most popular one. All parts of the herb is used. However, medical herbalists tend to use a blend of the roots of 2 species, so Echinacea purpurea and Angustifolia. And that's generally because a lot of clinical trials are done on that and have shown very good efficacy. It's a very well researched herb. There's a strong immune enhancing effect, and it's a good depurative, which is a blood cleanser. So in some of the trials, if you take Echinacea, it will decrease your risk of catching a cold by 58%. It's pretty significant. The duration of colds are reduced by an average of 1.4 days, and if taken prophylactically in low dose for prevention, it can work quite well. And if you have a flu, though, you take it in higher dose, so there's therapeutic doses for acute illness, and there's prophylactic doses for dosing can be quite complex. I encourage everyone to see a medical herbalist to use herbs in the best way. Garlic is another great one. You
always hear people mention the garlic.
Yeah, well, antiviral, antibacterial, it's really good at knocking out any infection. The best one is, I use it in a capsule form. It's a standardised one that has high levels of an ingredient, alliin. So it's shown in clinical trials to be the main thing that knocks out viruses and colds and so on, and bacteria. But it's also good consumed in the diet, raw or cooked. So if you can handle it, add it in. If you like it, great, go for your life. In clinical trials, garlic taken for 12 weeks significantly reduced the incidence of colds, an accelerated recovery period. So it's a really good one. Golden seal, or botanical name Hydrastis canadensis. It's the root of this herb we use, and it's their strongest natural antibiotic, golden seal. It's a great herb, really expensive because it's been over harvested and it's near extinction there a few times, but it's great at alleviating infections of the ear, nose, mouth, throat, and it's a good convalescence tonic. So if you're recovering for illness as well, it's really good. Also, one I mentioned earlier, licorice root, a standardised extraction of the root has a lot of clinical research on it to show that it's really good and offers protection against influenza virus through how it works is it stimulates the immune system.
Right, okay.
So all them are, I suppose, my top recommendations.
Cures and prevention.
Yeah, definitely. But I mean, it's a big thing, and a lot of people tend to have a flu, and then they're okay for a week, and then they're back into it again. Yeah. And in that instance, it's definitely, I always look at the diet, and I nearly always find something that could be holding back the immune system and inhibiting someone from really kind of getting rid of it, of a flu or infection altogether. And
okay, right. Gabriel McSharry, a medical herbalist and nutritionist. Now, we are inundated with questions, so what we'll do is, as we're doing every week, because of the volume of questions, we'll put them all to you, start our show with them again next week. There's anything from an 80-year-old suffering from cataracts to losing weight, a lady who's suffering from blisters on her hands. Quitting smoking has actually made this person's cough worse. You've actually said that it does get worse. Is it your lungs that are clearing out in your...
Yeah, if you think about it, if you were exposing your lungs to a toxin, say 10 or 20 times a day for years, the lungs respond by producing mucus. That's how it protects itself sometimes. And so then if you stop the exposure to the toxin, that mucus has to clear out, and how the body clears out mucus is it coughs it up in a productive cough. And so people think I thought I'd feel better when I give up the cigarettes straight away, but could just feel worse for a while. But it takes a bit of time. But look, I can just assure you that it's the best path to take.
Okay, and that lady's sore throat is actually a cataract. Do you know that?
Cataract.
Catarrh. No, it's a sore throat.
Oh, catarrh. Well,
catarrh.
That's build up of mucus. I thought it was a cataract of the eye. No, catarrh is, I suppose, the medical term for mucus, just so I was saying there. So she has a lot of mucus build up in the throat. I wonder, does she suffer from post-nasal drip from the back of the nose down into the throat, goes on to the lungs, can create infections there. Again, we have strong anti-catarrhal herbs, and herbs expectorants, we call them, which expect or allow the body to get rid of some of the mucus. And there's mucus forming foods as well she possibly would need to reduce.
Okay, all right. Well, we'll talk a wee bit more about that next week. Gabriel McSharry, medical herbalist and nutritionist, thanks for joining us in the programme. Of course, people want to contact you, they can on 91222832.
That's correct.
Okay, and of course you're back with us again next Wednesday morning just after 11 o'clock.
Great.